sick.
Wait, you have fever? Did you even go somewhere last night, like a vacation?
Well, yeah, I went camping last week in Nigeria and there was a lot of mosquitoes. Could it be dengue? Hi friend, did you know that mosquitoes is not the only vector for dengue, but also a vector for a disease called malaria? Can you spot the difference between this mosquito and this mosquito? This is Aedes mosquito, or this is Anopheles, and this is the one we're going to talk about. Infected Anopheles mosquito is an agent for malaria disease. What is malaria disease? Malaria is a disease caused by parasite from the Plasmodium genus, and they spread to humans through the infected mosquito's bite.
Causes of malaria. Malaria is caused by a single-celled parasite of the Plasmodium genus. The parasite is commonly transmitted through mosquito bites. So firstly, we'll talk about mosquito transmission. It begins with the uninfected mosquito, which becomes infected after feeding on an infected person or a person with malaria. This mosquito then proceeds to bite or to feed on an uninfected individual, infecting them. Once the parasite enters the body, it travels to the liver and sometimes can remain dormant for. Once the parasite matures, they leave the liver and infect the red blood cells. This is when people typically develop malaria symptoms. Okay, so there are some other modes of transport besides mosquito bites. The Plasmodium parasite that causes the malaria only affects red blood cells. People can contract malaria through blood transfusion, needle sharing used to inject drugs, or from mother to unborn child. Some of the symptoms of malaria include fever, flu-like illnesses such as shaking, chills, headache, muscle aches and tiredness, nausea, vomiting and diarrhea, anemia and jaundice, and if not promptly treated, the disease may become severe and cause kidney failure, seizures, mental confusion, coma, and death.
We wonder how malaria started in Malaysia. In Malaysia, the history of malaria started in the 1960s when about 240,000 cases of malaria were discovered across the country. The first naturally non-lethal malaria case was reported in 1965 in a man who returned to the USA after visiting Peninsula Malaysia. A second naturally occurring transmission reported in 1971. Human Plasmodium knowlesi infections occurred in Sarawak from as early as 1996 and in Pahang in 2004 until 2005. Plasmodium knowlesi infection were also described in Sabah from 2003 to 2005. Since the malaria eradication program was established in Sabah and Sarawak in 1961 and in Peninsula Malaysia in 1967, Malaysia has made great strides in the prevention and control of malaria. The highest numbers of indigenous malaria cases were recorded in 2000. Between 2000 and 2007, human malaria contributed 100% of reported malaria and 18 to 46 deaths per year in Malaysia. Cases decreased gradually to 3,329 in 2005. Then, over the next 3 years, there was a gradual increase to a peak of 6,071 cases in 2008, followed by a further decrease to 2,050 cases in 2012. The year 2018 marked the first year that Malaysia did not report any indigenous cases of malaria caused by human malaria parasites.
Hi, my name is Grace Dripping Gumis, and I will now continue on with the treatments and preventions for malaria. So malaria can be treated with prescription drugs that are used to kill off the malaria parasite. And this prescription will be depending on the type of malaria parasite, the severity of the patient's symptoms, the patient's age, and whether the patient is pregnant or not. The two most common drugs for malaria that are known are chloroquine and ACTs. And ACTs is basically artemisinin-based combination therapy where they use a combination of 2 or more drugs that can work together to eliminate the parasite. As we all know, there are a number of ways that we can do to prevent malaria, but these are more focused on avoiding mosquito bites in the first place. We can try applying mosquito repellent. We can also try putting screens on windows and doors. We can also try draping mosquito nets over beds so that we can prevent getting bitten in our sleep. And last but not least, wearing long sleeves and long pants to cover our skin. So in conclusion, malaria is a very serious and sometimes fatal disease that is caused by a parasite that can infect a certain type of mosquito, which in Malaysia, the history of malaria started in the 1960s when about 240,000 cases of malaria were documented across the country as the highest record. That is all from my group. Thank you.